Hi everyone, so today we're talking about gastric band surgery, which is a type of weight loss procedure. So in today's world, obesity is increasingly becoming one of the world's major health problems, with 22% of people in the USA having a BMI over 30, placing them in the obese range. Obesity is now recognized as a serious chronic disease and is a major concern as its side effects can lead to problems such as hypertension, increased risk of heart disease, stroke, as well as other issues, which can reduce one's quality of life. Weight loss as low as 5% has been shown to reduce or even eliminate issues associated with obesity and has been shown to lead to increased quality of life as well as improved mental health. Therefore, treatments of weight loss are necessary, especially for those who find it harder to maintain diets and physical exercise. So this is the gastric band surgery. The surgery is a type of weight loss surgery where a small band is placed laparoscopically around the stomach. It's best suited for people who have trouble sticking to small portions and works best for patients with BMI between 30 to 40, where only 20 to 25 kilograms of weight loss is required, and works by reducing hunger, reducing overeating, and allowing the patient to feel more full with smaller meals due to the smaller stomachs. Patients generally lose half of the excess weight within the first 6 to 12 months, and as the patient loses weight, the band is adjusted to maintain hunger and portion control. So the cost of the surgery with private insurance is around $2.5 to $5.5 thousand, while patients without private insurance will have to fork over close to $16,000 for the procedure. So the history of the gastric band procedure. So the gastric band procedure was first introduced by Wilkinson and Pelso in 1978 by placing a non-adjustable band around the upper part of the patient's stomach. By the mid-1990s, the gastric band procedure was becoming more and more popular with new innovations to the device, such as silicone being used due to its better biocompatibility. With the laparoscopic technique becoming more mainstream in the 90s, this made it possible for the procedure to insert the adjustable band without open surgery, allowing for less invasive surgery and a quicker recovery time. These aspects have led to the gastric band surgery becoming one of the most ideal weight loss surgeries today.
So this is surgical process. The surgical process starts by first making small incisions in the patient and inserting the laparoscopic camera through the incision to perform the surgery. Doctors will then use this instrument to make a small tunnel behind the stomach where they can insert the gastric band. The gastric band is locked around the stomach and connected by a tube to a port that sits underneath the skin. This port is used to give the doctor access to the band for adjustment after surgery so that they can customize the band length based on the patient's weight loss. The results of patients who undergo gastric band surgery are often very promising, with patients usually losing 20 to 25 kilograms of their excess weight within the first year after surgery. But long-term weight loss can be hard to predict and may vary patient to patient. High level of motivation, critical component for keeping the weight off, as those with poor levels of determination often fall back on old habits of eating unhealthy and not exercising, eventually leading them to gain the weight back.
So like any surgery, there are still a few risks that may occur during or after the gastric band surgery. These complications that may occur could be the band slipping, the access port rotating, the discontinuation of the tubing between the band and port, as well as reflux and heartburn.
So let's do the ethics. There are two main ethical concerns surrounding the gastric band surgery. The first one is patients who may go on developing an eating disorder. Patients who have undergone the surgery have to go on strict diets as their stomach is usually half the size of their original or even smaller. Studies have shown that some patients have gone on to later developing eating disorders, so it is important to consult patients on the risks that may come along with the surgery. The second ethical concern is the use of gastric band surgery on teenagers. The surgery is often seen as a quick and easy way to lose weight, and teenagers who undergo the procedure may have unwanted effects as they are immature. It is important for patients and their kids to discuss the risks and benefits with a professional before pursuing the surgery.
So there are three main competing technologies involved. The first is the gastric sleeve surgery, which reduces the amount of food the stomach can hold. This also triggers favorable changes in the gut hormones like reducing appetite, suppressing hunger, and controlling blood sugar. The second competing technology is the gastric bypass surgery, where a small pouch of the stomach is connected to the intestine. This contributes to weight loss by reducing the calories and nutrient intake. The third main competing technology is the biliopancreatic diversion, which bypasses majority of the intestine. This procedure limits how much patients can eat and reduces the absorption of nutrients. Now let's take a look at the advantages involved. The gastric bypass offers reasonably good weight loss results with very little morbidity. The surgical process is very minimal, involving a few incisions under general anesthesia. Therefore, the recovery time is very quick. It can also be removed, unlike other weight loss procedures. Issues involving leakage and internal bleeding are avoided, making it one of the safest surgeries performed. As the gastrointestinal tract is not altered, the risk of deficiencies in vitamins and minerals are also avoided. Now onto the disadvantages. When compared with other procedures as mentioned before, the gastric band does not offer as much weight loss. Along with this, patients must continue lifelong follow-up and remain devoted to good nutrition and exercise in order to maintain their weight loss. Also, with the risks involved, this type of surgery has a higher rate of reoperation and causes chronic pressure from the bands being over-tightened. Therefore, it is important that the patients are constantly reminded that the band acts as a tool to help them lose weight and that they use it correctly. Finally, taking a dive into the future prospects of the gastric band, the future of banding is likely to focus on chronic pressure from a tightly adjusted band, which is likely to be detrimental. Self-adjusting bands that could monitor pressure and deflate automatically during times of severe obstruction are a reasonable possibility in the future. Endoluminal placement is also a good alternative for patients who want fewer to no incisions without compromising efficacy. Looking forward, the simple adjustable band concept has a lot of potential to be a primary technique for maintaining long-term weight loss. Thank you for listening to this presentation, and we hope you have gained a thorough insight into the weight loss procedure that is gastric band surgery.